Hey everyone, Tom Swales here, Advanced Movement Therapist. Today I'm going to show you 3 quick movement screens for the knee to know whether you have a more likelihood of a meniscus injury or an impingement, or it could be a tear. So we're going to start with just a quick deep knee bend, okay? So it's kind of like your catcher squat or your hack squat. And what we're doing by allowing the heels to come up, we're allowing the knees to fully compress and stretch, compress the back of the knee, but also stretch the front, and utilizing the quads to also compress the patella. So if we got patellofemoral issues, this will cause problems on the front. If there's a meniscus or joint impingement, it might be creating some impingement in the back. The second test, we're going to come up into Thessaly's test, single leg balance. If you need to hold on to your client by their hands to give them support, go for it. But essentially, we're going into about 20 degrees of knee flexion, and we're getting into full rotation. Now, this test has a high sensitivity and specificity for diagnosing a meniscus tear. If it's more of an impingement, then typically won't get a lot of problems, a lot of clicking or catching. But if there's a tear, this is a good test to add to your arsenal to see if there's an issue. And if it's clear, we're going to go on to test number 3. The last test is just knee rocking. So we're going to come into a full kneeling position. Our toes are tucked underneath our hips, and then we're just going to rock side to side. So if there's patella pain or patellofemoral issues, this will kind of pick that up. You'll feel that underneath the kneecap. If there is some kind of joint pathology, the client will typically feel it around the sides of the joint or in the back. The most typical meniscus tear that typically needs surgery is usually your bucket handle tear. And this is anytime we get the client into full knee flexion and loaded, we're compressing the back of that knee, and we're going to irritate potentially that torn area. I hope that was helpful. Those 3 quick tests can quickly determine whether you can train your athlete that day or whether we need to refer on or go into a full orthopedic assessment to find out what is going on with that individual's knee. If you like this information and you want to know more on how to organize your practice and systematize your assessment and treatment flow, head over to amtcertified.com and get certified today.